everyone, and welcome to another edition of For the Health of It. I'm Lou Beccaria, your host. Glad to have you with us once again. The topic of our show today is dental care. We all know that in order to have a truly healthy community, there needs to be very good dental care availability in our community. Likewise, we all have to know how to adequately take care of our own dental needs. Well, we're fortunate here in our greater Phoenixville community because we have an abundance of very good dental care options available to us. But we need to know what their capabilities are and what our own responsibilities are in caring for our teeth. After all, after our baby teeth, we only get one set of permanent teeth given to us. So here to inform us about good dental health care is Dr. Lon Kessler of Kessler Dental Associates. Tell us a little bit about your background so we can get to know you up close and personal, so to speak.
Well, I grew up in the Phoenixville area. My father actually had a store downtown called Cherry Shores many years ago.
I didn't know that.
It's amazing, a lot different than the town is now. We lived in Audubon, and I went to Methacton High School, then went to Rutgers University undergraduate, received my dental training at University of Pittsburgh, and I did an additional residency at Robert Wood Johnson Hospital in New Brunswick, New Jersey. Then I moved to Phoenixville, and it's been about, well over 30 years since I've been here. So what happened was Dr. Axler was the original dentist who I joined his practice. Then what happened was we got too big at our location. We then moved out into the Valley Forge area, built a brand new office. We've expanded. Dr. Axler has since retired, and we have a larger dental practice now. We have specialists on staff. We have periodontists. We have orthodontists. I have 3 general dentists, and we're still treating patients that have been with the practice for 50 years. As a matter of fact, this year will be our 50th anniversary.
Wow, well, congratulations. That's great. That's great, and it's great that you've been such a vital part of the community for all those years. Dr. Kessler, how often should one visit a dentist? How frequently do we need to do that?
We recommend that everyone should see the dentist a minimum of 6 months. However, we have certain patients, they build up a lot of calculus, a lot of tartar. Some people just like to come more often. And also there are patients that have periodontal disease, which we'll hopefully get into later. And for those patients, we recommend every 3 to 4 months.
Now, you just used the word that I'm not familiar with. You said they build up calculus. What does that mean?
So what happens is in the mouth, you have these there's almost like little collars around, the gum forms a little collar around the tooth. So what happens is food gets caught in there. And then when the food gets caught in there, then you have a bioimmune response. You got proteins in your saliva. Then what happens is they start to build up plaque, and then the plaque, if not removed, builds up into hard deposits, which is called calculus or tartar. Okay. And if it's not removed, if it's not removed right away, it can develop into periodontal disease. However, in the beginning stages, you just have inflammation, which is created by a bioimmune response to this calculus, and you have some inflammation. That's known as gingivitis, which is reversible. That's why you come to the dentist every 6 months, especially 3 months, 4 months, not a problem. However, what happens is when these, the calculus or tartar, these hard deposits stay there, you get the inflammation, okay, then the body's response, you build up all these enzymes and then acids, and what happens is it starts to, there's these little attachment around the teeth, so the enzymes, the acids start to eat away at the attachment. Then even if left longer, if it's been a while since somebody's been to the dentist, you start to lose bone, and thus you get periodontal disease.
What are your recommendations, Dr. Kessler, for how we should take care of our own teeth at home in our daily lives?
The home care recommendations are, again, first and foremost, we do recommend you see your Dentist, like I said, every 6 months or 3 to 4 months if necessary. We recommend, and Lou, I'm sure you use an electronic toothbrush.
No, I don't.
You
but
don't?
I,
Okay, Lou,
but
okay, okay.
But I
We'll
brush
have to
very,
talk.
very frequently.
We'll have to talk, okay. I do recommend electronic toothbrushes. You know, I don't want to push any brand names. Everyone's familiar with Oral-B, Sonicare. I also recommend, you know, water irrigators. You know, Waterpik's a well-known name. And any fluoride toothpaste will do. I get this question all the time, what toothpaste are good? Any fluoride toothpaste are good. Obviously, if you want to whiten your teeth, there's whitening toothpaste. If you have sensitive teeth, there's sensitive toothpastes. And I also sometimes recommend fluoride gels as a preventive measure and some antimicrobial rinses. And don't forget the floss.
Okay, flossing is very important, yes. What is gingivitis, Dr. Kessler?
Yeah, well, gingivitis, again, as I said before, what happens when you have that buildup of plaque, and now we know what calculus is, and it is not removed, the body's immune response, you start to develop inflammation in the area. So pretty much gingivitis is reversible. It's more or less you have inflammation, some slight bleeding, and it can, you know, the tartar calculus is removed, and you should be good to go. And as long as you maintain your you know, cleanings and your oral health.
Right. Dr. Kessler, what is periodontal disease? Now, periodontal disease, is that something that gingivitis, if left unattended, can lead to the periodontal disease?
Absolutely. Again, so what happens is if this calculus and this or tartar stays there prolonged times, then you get these responses with the enzymes, as I explained before, and it starts to, you know, produce acids and destroy the attachment around the tooth. And along with the longer it goes, then you start to lose bone. And I have a little diagram here, if I can show everyone. And so what happens is first you start with the inflammation, the gingivitis, and then as this tartar is not removed, you start to have some responses, and which leads to bone loss. Okay, as you can see, the more we go, okay, the gums start to dissipate, the attachment goes away, and you get bone loss and eventual tooth loss.
Wow. And over what period of time does all that take? Does it take a long period of time for all that to develop, doctor?
It's a progressive disease. You know, however, some people, depending on your oral health, depending on, some people are more prone to periodontal disease. There may be some genetic component to periodontal disease.
What can the average person, Dr. Kessler, do to prevent periodontal disease?
When people have periodontal disease, the studies have linked it to heart disease, strokes, and even Alzheimer's.
Wow. I want to come back to that. Including myself, didn't realize that. So thank you for all this good information. Dr. Kessler, what is periodontal disease?
When you have periodontal disease, there's bacteria that gets into the bloodstream. And there have been several studies linked to the bacteria causing heart disease, stroke, and even Alzheimer's.
Is that right?
Yes, and that's why we feel it's very important. And once you lose that bone, you don't get it back.
Let's move on to another topic that a lot of people probably don't realize, or it's related to dentistry. And what is sleep apnea?
Sleep apnea it's a sleep disease where you actually start and stop breathing during the night. The most common type of sleep apnea is obstructive sleep apnea. And I have my little model here to show everyone.
Sure.
And what happens is in obstructive sleep apnea, you know, it's very good. I don't know if anyone can see this, but you want to breathe. Most people breathe through their nose. It's better to, if you can, keep your mouth closed while sleeping. That's the best way to do it. You want to get a really nice airway breathing through your nose. However, what happens when we sleep on our back, as you can see here, you know, you're sleeping on the back, the tongue starts to occlude the airway here. Sometimes we find that if you're in obese or overweight people, they're more prone to having sleep apnea because you have a lot of the fat tissue develop in the airway. And what happens is the airway becomes blocked. That's why you often wake up, go back to sleep, wake up, and some people, if it's bad enough, even find themselves gasping for air.
Wow. Can you die from that?
Absolutely. Rumor is Justice Scalia, his CPAP was beside his bed.
Is that right?
Yes.
Jeez. Yeah, I think there's some rumors too that Reggie White,
Oh, absolutely.
the football player for the Eagles,
Absolutely.
died of that.
Absolutely.
As well.
And there's probably if you hear about people dying in their sleep, a lot of times that's why people die in their sleep.
Wow.
Very, very serious.
How is sleep apnea treated?
Yes, the first thing we do in our office, we screen all our patients with a form we call Stop Bang, ask them questions. And most people, again, if you snore, if you find yourself very tired, that's some indications that you may have sleep apnea, and obviously the gasping for air. We screen everyone. If they seem to answer a lot of the questions, which indicate, hey, there might be a chance, as dentists, we make the oral appliances, which I will show you later. However, it's physicians. We work with all the physicians in the area, a lot of pulmonologists. Phoenixville has a very good program. I work with them a lot. And we refer them to the physician. The physician will then administer or send them with a home sleep test, usually for one, sometimes 2 nights. And by the results of the test, they can determine whether or not the patient has sleep apnea. Then if they do have sleep apnea, then depending on if it's mild, moderate, severe, if it's sometimes moderate to severe, they may, everyone's familiar with CPAPs. That's continuous positive airway pressure. That's where you have the tubes and the mask and the noise, and that's what is recommended a lot of times. However, as a dentist, we often fabricate custom oral appliances, which will also help with mild to moderate sleep apnea. And that's what I do a lot of. And these are some of the appliances here. What they do is these appliances what they do is they move the lower jaw forward and help create an airway there. So this is what we manufacture in the office, or we actually take digital impressions, send it out to a laboratory. This is just another kind. There's about 150 different sleep appliances.
Is that right?
Yeah, there's multiple depending on anatomy. There's, depending on the patient. That's why we have a patient in. I personally am feel very strong about sleep apnea. I say nobody's going to die from a toothache. I recently become a diplomat of the American Academy of Dental Sleep Medicine. So we actually have a separate sleep practice called Better Sleep Solutions, where we treat a lot of sleep apnea patients. And after they come and we evaluate everything, we determine what type of appliance is necessary.
No, I know a lot of people who have been diagnosed with sleep apnea and who are asked to start using the CPAP machine say that it's very difficult to start using. It's uncomfortable. And well, what about the appliance that you were talking about? Is it equally difficult to get used to?
Lou, great question. A majority of our patients that come to us for sleep apnea, a lot of patients are referred to us by the physicians if they have more of a mild, to moderate sleep apnea, but a majority of the patients have a very difficult time adjusting to that big hose. You got the noise, you got the mask, and the studies have shown that CPAP is very effective in treating sleep apnea, mild, moderate, severe. However, a majority of patients will only wear that about 4 hours a night, and a lot of physicians will track this wearing time with chips in the machine. So a lot of patients they actually seek us on their own because they just can't wear the CPAP, or the physicians will refer them to us because they're just not getting any good result. And these appliances here are very comfortable. People wear them during the night, and as a matter of fact, when I've had times where a little part has, broken off, and sometimes we have to replace it, and people cannot go without these once I make it. They just love them.
Wow. Dr. Kessler, I'd like to ask you about insurance. Do insurances cover the treatment of sleep apnea with the various appliances that are available to treat it?
We get that question all the time.
It always comes down to money.
Unfortunately, dental insurance does not cover it. However, this is a medical procedure. It is diagnosed by a physician, and medical insurance will cover these appliances.
Okay, so dental insurance will not, but medical insurance will cover.
Will cover, okay. And we are a Medicare provider, so we do see a lot of Medicare patients in need of this, and they just thank us every day. And they sleep better, their lives are better, and it's awesome. I love when we make these appliances.
My guest is Dr. Lon Kessler from Kessler Dental Associates, and we're going to take a break here for our commercial sponsors, and we'll be right back, so stay with us. We have the pleasure today of talking with Dr. Lon Kessler of Kessler Dental Associates, all about the various aspects of dental diseases as well as good health care related to dentures and our given teeth. So why is a healthy smile so important, Dr. Kessler?
Well, when I see a healthy smile, obviously you have a good oral environment. You go to the dentist every 6 months, as we discussed previously. However, everybody likes to eat, okay? And most people like to be able to smile. So you have the person who can walk into the restaurant, you can smile, you can order whatever you want off the menu. But I have a lot of patients that come in, and unfortunately they don't smile because they're
ashamed of their teeth.
They're ashamed of the looks. Sometimes they're missing teeth. Also, they haven't been to the dentist. They may have periodontal disease, dental abscesses. They can't chew and it hurts. So they go to that same restaurant. They don't smile. They can't enjoy their food. And what I enjoy is giving patients that healthy, that beautiful smile, and give them the ability to function, chew, and eat, and have a very good lifestyle.
Is whitening of teeth considered an aspect of having a healthy smile, doctor?
It's a good question. I find whiter teeth is more of a cosmetic procedure. However, you find someone, once you get those whiter teeth, all of a sudden your home care steps up, everything else steps up, you brush, want to maintain them better. So in essence, it does lead to a healthier smile.
Yeah. And let me ask you this. What is the difference, Dr. Kessler, between dentures and implants?
Dentures are, I consider, they're temporary. You take them in, you take them out. Sometimes, people complain they're loose. Some people are embarrassed to wear dentures. And prolonged use of dentures, especially people that keep them in at night, we want everyone to keep them out at night, causes bone loss.
Oh.
Yes. Implants, on the other hand, and plus with dentures also, you can't taste your food a lot of times. It covers up the taste buds. With implants, it's like having your own natural teeth. Your taste buds are not covered up. You can smile and not worry about your denture coming out. So that's why people prefer implants.
So basically they do the same thing. It's just one's temporary, so to speak, and one's more permanent.
Yes.
Okay.
Correct. You can have partial dentures, full dentures. The same thing with implants. You have single tooth implants, or I can show you if you want to see a model, or there are what we call, you hear all-in-4 implants,
right,
where there are dentures that are actually supported by dental implants and are more of a permanent solution.
Okay.
Clear dental plan, what we find, it always bothered me with insurance. We found out that a lot of our patients that didn't have insurance, we felt, hey, you have all these insurances, they're covering a lot of services, and it's hard for someone without dental insurance. However, what we started several years ago, now we've turned into, it's the Kessler Dental Plan, and and Clear is the company that helps us manage the plan. What we do is our patients are given, they pay a fee, a yearly fee. We have plans, we have periodontal plans, we have just plans, if you have to come every 6 months for different fees, and it covers all your cleanings, all your x-rays, all your exams, and in addition, our services are discounted. And we find insurance companies limit what can be done. They're always questioning, we have to take extra x-rays for predeterminations. With the Clear plan, we can do whatever is necessary, there's no maximums, and again, our patients love it.
Yeah. Going back to the dental implants, because I'm fascinated by that, does anyone who is contemplating implants have to see a specialist, or can they go to a regular dentist?
Yeah. General dentists are able to surgically place implants, and they're also can restore implants. In our practice, I believe we have specialists, we have periodontists in our general dental practice who place the implants. I feel they've gone to school, they've done a lot of extra training. As a matter of fact, we have a periodontist who's a board certified periodontist, and also we have a board certified orthodontist as well, and that I feel he does a much better job doing it. He's, in my opinion, and the actual specialists we have in our office have been doing it for over 30 years.
Wow, that's a lot of experience. How has the field of dentistry, Dr. Kessler, changed over the many years that you've been in practice? I
think the biggest change that I've seen, other than insurances, everyone goes through insurance. That's always changing. I think the technology. In our office, Lou, we can make crowns. We call a CEREC machine where we can actually take a picture of the tooth after we prepare the crown. We can manufacture the crown in the office, and the patient works out of the office the same day with their crown. We also have another scanner, which is, we call it the iTero scanner. And what that does, we use that for Invisalign, and I use it on my sleep appliances. We digitally scan the mouth. Mm-hmm. We can send it to Invisalign. They will make us the aligners for the Invisalign, and they also will manufacture the appliances for us if necessary. And we can also show people where and show them everything about their mouth.
So the digital world has caught up with dentistry.
Yeah, I think that's the biggest change.
Biggest change. What kind of research is going on too with over these years that has created such a change? And what kind of research is going on now?
Well, you do hear, I've actually, every now and then it appears, hey, there's, cavities will be eliminated, through, as a matter of fact, there's a system that we use now. It's called a resin infiltration system, where it can arrest decay. And also people who have little white spots, a lot of times you get decalcifications after orthodontics that happens, and you can actually paint this material on the teeth, and it actually will remove the white spots, will help strengthen the tooth. So they do have things. I think there's always been that vaccine out there that's going to eliminate tooth decay. There's also going to be the gels you can put into the tooth and don't have to drill. And there's lasers out there now. There's a lot of things on the forefront.
I do want to ask you about the dental hygienist, because everybody, I'm sure, is thinking about that. Why do I see a dental hygienist when I go to the dentist office before I see the dentist?
Anyone, dentists, please forgive me, anyone who goes to a dentist and the dentist cleans their teeth. Now, periodontists doing scaling, deep cleaning, root planing, that's fine. However, general cleaning, dentists, we go through dental school. We're not really trained, we do not receive extensive training at cleaning teeth. We absolutely don't. Some of us enjoy it, don't enjoy it. I personally enjoy doing other things. Hygienists, especially our hygienists, they love doing hygiene. They love educating the patient. They're very professional. Hygienists now can give injections. And I'm all for, you should always see the person who you feel will do the best job, and I'm the first to admit my hygienist will do a much better job at cleaning teeth than I will.
Well, that's very honest of you. Okay. All right. Well, I think we're just about out of time, Doctor. Thanks very much for anything. Wait, actually, before we sign off, any tips, final tips for our viewers about how they can avoid going to the dentist too much in terms of having bad teeth?
Well, my big thing is you religiously, most dentists, we have a 6-month alternating recall schedule. All our patients are scheduled in advance, and it's so very important to see your dentist on those regular cleanings. Obviously, brush twice a day. You want to floss. The water pick, as I mentioned, helps. And that's pretty much my key to success.
Okay, well, that sounds like a good prescription. So thanks again, Doctor. Appreciate you taking time out of your practice to be with us and to actually provide a public service for our people in our community. So thanks
and Lou,
again.
thank you so much for having me.
Well, folks, that's about all the time we have for our show today. We thank Dr. Lon Kessler for being with us, for the fine information that he imparted, and for giving us his tips on good, appropriate care. So we appreciate them all. And until next time, on For the Health of It, remember, if you're healthy, you're wealthy. I'm Lou Beccaria, and I'll see you next time. So long, everybody.